You're listening to Be Health Connected, a podcast by the Gateway Business Health Coalition. Your host for today's episode is Laurel Pickering, BHC President and CEO.
Hi, I'm Laurel Pickering, President and CEO of Gateway Business Health Coalition, and welcome back to BHC's Be Health Connected podcast. Today, we are talking about cancer. When I started at BHC about a year ago, I did a listening tour with the members, and I tried to meet as many of them as I could. And one of the questions that I asked them was, what are your top 3 conditions that your employees are dealing with that are challenging for you from a cost perspective and challenging for your employees? And almost across the board, all of them mentioned cancer. And today we are thrilled to be joined by Dr. Rebecca Miksad, who's the Chief Medical Officer at Color. And Color is the first 50-state virtual cancer clinic led by oncologists, delivering high-quality, patient-centered, and technology-enhanced care across the entire cancer continuum, from screening, risk assessment, and prevention to diagnosis, treatment support, and survivorship. Now, there's a lot to unpack there, and we are going to get into that. Some of you may have met Color at our community forum in April, where we focused on workplace mental health, but Color was there as a vendor supporting us. So I hope maybe you had a chance to meet them then. But today we're going to learn, more about what Color does, but also what employers should be doing and thinking about when it comes to cancer. All right, well, why don't we dive in? And as I said, Dr. Miksad is with us. We're thrilled she's here, and she's going to explore this really important topic for our members. Thank you so much for joining us, Dr. Miksad.
Thank you, Laurel. I'm really excited to be here and love what you and your group do.
Thanks. So could you briefly share your background and what led you to your role at Color?
Yes, I am a medical oncologist, and my journey to Color really comes from sitting with patients in the clinic room, going through their cancer diagnosis and really wanting to make a bigger impact and be able to provide more for my patients. It would be even better if my patients didn't even make it to my room. So how can we risk assess and screen and prevent so they never need chemotherapy? And if they need chemotherapy, how do we provide that center of excellence support to the patient no matter where they are, whether they're in rural Texas or in the middle of the inner city or at a high pressure corporate job and just don't have time to go in for an in-person visit on nutrition or those things. So how can we change the perspective about cancer that yes, it's complicated and it doesn't have to be complicated to solve it?
So for those that aren't familiar with what Color is, and you've given us a hint of why you came to Color and some of the things that Color does, why don't you explain to us, how does the virtual cancer care clinic work?
The virtual cancer care clinic is our answer to all of those needs that I've seen and my colleagues have seen, and I'm sure your members have seen with their friends and families of where these gaps happen for cancer. As a virtual cancer clinic, we are 50-state licensed and can take care of the patient no matter where they are. And we work closely with their brick and mortar physicians to provide that comprehensive support. Because we're partnered with the American Cancer Society, which is a really important component of our work to focus on guideline-based care. And this is important for your employers when you're thinking about your insurance plans and coverage. We're always thinking about how do we best align with standards of care in the industry that are almost by default going to be aligned with what insurance plans are covering. So I think that's a really important focus. The other focus that I think is really unique, and why I think we can turn cancer from complex to straightforward, is by having that single cancer lens from the very beginning. So there's not fragmentation between who does what within a cancer journey. And the cancer oncologist experts that lead our virtual cancer clinic are involved from the very beginning, so that there's a trusted partner, a co-pilot throughout the whole process. Some people call us a cancer PCP, which isn't a wrong term, because we want to be in the best version of that physician and cancer and care team that follows you throughout your whole life.
That's exactly what I was thinking as you were describing it. And I was thinking about how we now have virtual primary care practices, and they act as navigators towards specialist care, often to what brick and mortar specialists you have available, some to virtual specialists. So that's funny that that's what I was thinking as you were describing that. But I want to pick up on what you said, if I remember this right, taking cancer care from being complex to more standard. And cancer care is complex, and people think of it that way, especially right after diagnosis. And it's very hard for patients to navigate. In addition to the cost of cancer for employers, they really want their employees to be taken care of and helped. So can you explain Color's model, but then also, generally how virtual models can improve both the patient experience and the outcomes? Because I think help navigating turns it from complex to something that feels more manageable.
Yes. And I think the key there is having that oncology expertise and the ability for an oncologist to assess the case and then get some ordering done to move treatment, to move symptom management forward. But I'm actually going to start way back in the beginning, because I think it's important for your employers to have a real pathway journey in mind of what might happen to one of their employees. Because we really want to develop that relationship, be the trusted partner, we work really hard with our employer clients to engage their employee population. So our goal is 20 to 30% engagement the first year of people having engaged to assess their cancer risk factors.
Before they even have cancer is where you're going, where
Before
you're
they
starting.
even have cancer, because yes, let's put me out of a job. I never want to have to give chemo again. If we can prevent it or detect it early, that's the biggest win, both for the patient as well as your checkbook, and for the patient to be able to come back to work. And that high engagement up front really enables us to establish that relationship. And I think you'll find that it actually helps patients engage with other point of care services that the employer may offer, where typically engagement tends to be more in the single digits, even low single digit numbers. So the first step is really that engagement. If the patient is diagnosed with cancer by us and our screening tests, and we go out of the way to make it convenient with either home-based testing or scheduling and ordering mammograms. So not just navigating you to the PCP to get it ordered, but actually take ownership of the ordering and the follow-up. Patients can also interact with us at other time points. So if they've been diagnosed outside, we also work with those patients. And really at that critical time of diagnosis that you described as being so fraught, and where we just want to, as benefits people, just put our arms around our employee and say, okay, we can get through this together. That's a critical place where we really serve as the first opinion. So while the patient doesn't know where to go to, and their primary care doctor isn't an oncologist, so they're unclear, do I order this test? Do I order that test? Or that's a cancer I've never heard of, so I have no idea like what your survival is, or should you go see a surgeon first or oncologist? Like there's a lot of missing information that tends to get filled in by Dr. Google, which can only increases people's stress level. So we're able to step in. We've had a relationship with the patient and be like, we're cancer experts. This is what you need to do. These are the things you need to consider. We can start getting these tests going. So in addition to navigating you to the earlier appointment, we can also navigate you to earlier treatment because we get a lot of that workup done before you even see that surgeon or see the oncologist, such that there's more momentum to getting to the right treatment the first time around. And then we
And
follow the patient through that treatment support, providing 24/7 symptom management, virtual nutrition, behavioral health, and then that critical next transition to survivorship and back to health, back to their roles at work, roles in the family, roles in the community, so that you really are able to live a healthy life post-treatment for cancer.
you really did touch on the continuum and as you answered that question. And our members ideally want to prevent illness from happening. I mean,
Mhm.
that's where we really need to be. How do you think we're doing as a nation screening? Are screenings increasing? I think about breast cancer, colorectal cancer, and others. I'd love your thoughts on that with all the focus that employers and others do on getting their employees to get their screenings.
Yes, as I'm sure all your employers know, the increase in cancer, particularly in working age adults and particularly in working age women, is increasing. That was documented by the American Cancer Society this January. And you ask about screening uptake, depending on which population you're talking about, there's reasonable uptake for screening for breast cancer, cervical cancer. People still more around the 50% for colonoscopy and colon cancer screening. I think people just the ick factor. One place where things are, for lack of a better word, atrocious is lung cancer screening. Depending on the estimates, it's between 10 and 14% of patients have gotten lung cancer screening who actually qualify. That
Wow.
is that is really bad news because for lung cancer, if it's caught early, we can cut it out. If it's not caught early, then you need the big surgeries and the big immunotherapy. Your employers know how much immunotherapy costs, and it's not great for the patient and much less likely that you'll have a healthy employee being able to come back and contribute at the level that you want them to. So the big call out that I think is really under recognized is this enormous gap in lung cancer screening.
I'll say wow again. I had no idea it was that low for people that it's recommended for. So I have to ask, what can employers do about that one in particular? Do you have any recommendations?
My recommendation is to think about cancer screening in a comprehensive package. While Colorectal Cancer Awareness Month and Breast Cancer Awareness Month can be important levers to activate a patient who might have a particular concern, thinking about, yes, let's get your mammogram, but it's part of a broader cancer screening assessment.
Mhm.
And by thinking of it in a risk assessment perspective, regardless of which cancer screening is the motivating factor, you can really help personalize around the guidelines which cancer screenings are most important for that individual, including, and this is another area that's very much under recognized, is the different categories of high risk. So age-based cancer screening guidelines are great and everybody should follow them. And there's other things that might change your risk and which types of screenings we do, what age we recommend those screenings to happen. So, for example, If you have a first-degree relative with breast cancer, and you're female, your increased risk for breast cancer is high even if you don't have a genetic mutation. So we can actually even calculate the score that insurance companies do accept, that once you have a 25% likelihood of having breast cancer at any point in your life, we recommend the addition of breast MRI to the mammogram. If you've already aged into mammograms, we add the breast MRI. If you haven't aged into breast mammograms, then we recommend just the breast MRI. And that has to do with things like breast tissue density in terms of that age cutoff. And that's really critical. I also want to diagnose you with a genetic syndrome if you have it, because that's important for many reasons. But even if you don't have a genetic syndrome, there's other reasons that we need to watch you a bit more closely.
All right, so you're saying it should be part of a comprehensive screening education that employers need to do, and to make sure that lung cancer screening is in there and is equally discussed and educated on. Great. You did mention survivorship. I know we're going to the other end. Because of early detection treatments that we have more people that are surviving. I heard cancer is becoming a chronic disease in some cases. What does survivorship care involve, and why is it often left out of the conversation in employer-sponsored benefits? And this is interesting because recently I've had a conversation about survivorship with one of our very large employer members, and trying to understand who has survived and is living in survivorship. And then also with one of our pharma companies that supports the Midwest Health Initiative, we had a similar conversation about survivorship. So I'd love to hear your thoughts on, what can employers do around survivorship, and how important is it to be part of the conversation on cancer?
I think you pointed out the first step, which is to recognize that we often don't even know how many people in our employees are cancer survivors. Just based on pure incidence of cancer, how much happens each year, most employers have 5 to 10 times as many survivors working for them than they do actual cancer patients in terms of receiving active treatment. So this is a very invisible group. And in addition to being invisible within the employees, it's also sadly invisible within the medical communities. And let me give you an example. As an oncologist, I give patients treatment with chemotherapy. At the end of chemotherapy, my patients usually ring a bell to signal, like, thank goodness, never have to go back there again. And they often cry. And if you ask, they're like, yes, thank goodness I never have to come back. And oh my God, I can't believe I never get to come back. So people go from seeing their care team like once a week, once every other week, to not seeing them for 6, 8 weeks, 12 weeks. And that's where this vacuum really happens. As an oncologist, I feel like I can say this, that as a system, we do a disservice to those patients. The oncologist has moved on to the next patient who needs active treatment, and primary care physicians who do the best jobs they can haven't had oncology training and don't always know what problems to look out for, or what treatments can help with long-term symptoms or complications. I'll give you 2 examples for different types of employees your employers may have. One would be somebody in the manufacturing side, a very physical labor job. One of the most common chemotherapies for colon cancer, it's called oxaliplatin, can give a really bad complication called neuropathy, which is a numbness and tingling of the hands and feet. Yeah, that might sound uncomfortable, but it can get so bad that you can't hold a piece of paper. You can't lift up that machinery. You don't know that your hand is getting too close to something on the work floor. So that can actually be a real occupational health issue. And the types of treatments for that are relatively nuanced and not common knowledge among the PCP world, even in the oncology world. But and another one that might resonate for more white collar employees is fatigue after radiation. A lot of my patients think about taking time off during radiation because it's every day. And I actually say, the first couple of weeks you might feel okay. Radiation is just like drop in for 30 minutes and then get to work. At the end of radiation, even several weeks afterwards, is where that fatigue hits in. The fatigue of like, oh my God, I can't even get out of bed. So when I'm talking to an employee about like, when should I take my FMLA? My employer's generous. I also want to continue working and I want to be judicious about it. Let's take it towards the end of radiation and maybe a few weeks after. So having that sense of how we can best support patients through the treatment and the complications is important both during the treatment and then in that survivorship phase.
Well, I think one thing I'm taking away from this is that at BHC, we should be talking with employers about survivorship and what they can do for those employees and how to think about that. I did not realize that more people are survivors than dealing with cancer. And so that's a great takeaway for us. I do want to make sure we touch on treatment before we leave each other today. What are some common gaps in traditional cancer care that employers may not be aware of, but should be helping their employees with while they're going through treatment?
That's a really important question. And I think the answer will be unique for each employer and each culture of the workplace. I think really critical is that the employee feels like they have a trusted advisor. And the benefits team at an employer may or may not have that expertise or time. And the best way to help the employee get through is to have a cancer expert being able to hold their hand throughout the whole process, both to help make decisions, to provide guidance if these are the questions to ask. Even better if they can prescribe treatments for these less common side effects that they may not be able to get attention to within the traditional healthcare system, such that cancer perspective is always there, so the patient doesn't have to worry about that cancer perspective. We can take that burden off of them so they can focus on getting healthy and getting back to the things they love.
I think that makes a lot of sense, and that has been missing with traditional cancer care, is having someone to help them through the process. And employers would really like their employees to have that. I mean, they're very concerned about the experience of their employees through a diagnosis and a process of getting better with cancer. Well, Dr. Miksad, we covered a lot of things. We covered prevention and screening, and we have some takeaways from there, especially around lung cancer screening. We've covered survivorship, which I think has been invisible and probably something we should be looking at BHC. And then the treatment itself we covered as well. So we are going to end our conversation here, but for our listeners, if you'd like to continue learning about color and continuing this conversation, they are going to be featured at the Innovation Forum on June 25th. And thank you so much, Dr. Miksad, for joining us today.
Thank you, Laurel. It was a pleasure. And thank you for all your work you do and the employers you work with do.
Thanks for listening to Be Health Connected, empowering healthy workforces one conversation at a time.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the Gateway Business Health Coalition, please visit www.gatway.org. gatewaybhc.org.